record this. Let's make sure. Okay. Well, hello, everyone. Thank you so much for joining for our Women's Health Lunch and Learn. My name is Michelle Hazlitt. I'm the coordinator of student wellness. So Krishna Patel and I cover student wellness. That is anything from COVID case management, health insurance, to any of the preventative or supplemental programs that will either prevent you from or go along with treatments or services you might receive at the Student Counseling Center or at the Hosler Health Center. A little bit of background information on me. I am currently getting my Master's of Health Science from the University of Florida in One Health. So the idea of One Health is that the environment, wildlife, human health, all of that is interlinked. So whether that is, chemicals that you come across in your daily life, the sun causing cancer, green spaces in cities being better for mental health, vector-borne diseases such as COVID, all of that stuff is stuff that I really focus on throughout my courses. So if you have any questions on that throughout this presentation or really just ever, please feel free to reach out to me. But with that, we will get started. I want to say a special thanks to the Women in STEM committee who've been helping me put this on. You guys are great. And let's make sure that this actually fixed. Okay. So the main topics that we are going to go over today are beauty and cosmetics, reproductive health, some general information, sun safety, medications, and then I'll give you guys a chance to kind of open up and ask some questions. Before we start, I do want to add in there that this information does not only apply to women. I keep saying the term woman because, for one, that is the term that the FDA used. And, when they were giving statistics and everything like that and using the term woman, I didn't want to butcher their statistics necessarily or anything like that. So I just kept saying what they said. And also because it is Women's History Month. So that is the reason that we are putting on this presentation. So I did want to do something to, focus on, not only women in STEM, but just the women on this campus in general. But keep in mind, this information does not only apply to women, to people with vaginas, but things like sun safety apply to anyone, regardless of how you identify. So if you find information in here useful or interesting, please pass it on to anyone you know. So we are going to start off with beauty. In general, with cosmetics, you should always read the label and follow the directions. And most of that is going to be to limit the amount of germs or bacteria getting into your cosmetics. So the next few bullet points really are just focusing on limiting germs. So make sure that you're washing your hands before you use the product. Don't share makeup with your friends, especially eye or mouth makeup. Keep containers clean and closed tight when not in use. Throw away cosmetics if the color or smell changes. This just happened to me with a tube of lipstick, so that got tossed. Make sure that you're using aerosols or sprays in a place with good airflow. Don't do it while you're smoking or anything like that. That could ignite. And then don't add saliva or water to mascara. That's really, really common if you are trying to make your mascara last just a little bit longer, but you could end up adding in germs. And of course, if you get an eye infection or anything like that, you should throw away your eye makeup. So again, with that, just keep in mind too, a lot of people do put on their makeup or other cosmetics, lotions, whatever it is, in the bathroom. And that just in general is a place that's going to have a lot of germs. So I know it might not be your first instinct to wash your hands before you're putting on makeup, but it is a really good thing to do. Don't use cosmetics near your eyes unless they are meant for your eyes. I see this a lot happening on, TikTok or other kind of beauty how-tos. I see a lot of people putting, lipstick on their eyes. Just because it was deemed safe to be ingested or swallowed doesn't mean that it's safe to get in your eye. It doesn't mean that it won't cause blindness. So just be really careful with that, especially with your eyes. If it's not meant to go near your eyes, don't put it on your eyes. As far as tints and dyes for your eyelashes, the FDA actually does not approve any coloring for your eyelashes or your eyebrows. So just keep that in mind. And then of course, make sure you are holding still. Even a small scratch or, wound from a mascara wand or anything else can end up with a serious infection. So I know I've done it before. I'm being a little hypocritical right now, but don't apply makeup in the car, especially mascara, because that's a really pointy wand. As far as ingredients go, it is really important to kind of like the first bullet point on that last slide to read the instructions, read everything that's on that. Because a lot of times the makeups, the warnings, the tips, and all of that stuff is really important. And I will say there are a few terms that the FDA doesn't actually regulate. So hyperallergenic, organic, and natural. These are things that the FDA might regulate on food. The Food and Drug Administration regulates it on food and drugs, but they're not necessarily regulating any of it on your makeup or cosmetic products. So just because it says hyperallergenic on it does not mean that you won't have an allergic reaction. You might be hypersensitive to some chemicals that other people are not. So if you do at any point get a rash or anything like that, stop using the product immediately and reach out to a healthcare provider to see their suggestion on how to take care of the product. You might need it, another type of treatment or something like that. Same thing with organic and natural. The FDA does not define what that means. So just because you see that the ingredients or you see the tube or container says that it's organic and natural, it doesn't necessarily mean that it's any safer than the other products that are on the market. In general, I would like to say that avoiding chemicals is a good thing to do. So typically, if you are using products that have actual natural ingredients on it, that should be better than if you're using products with a lot of chemicals. But if that is something that you really care about, if you care about using all organic, natural products, even if you care about using products that don't test on animals, make sure you're actually reading the ingredients and then even doing some further research behind those companies to make sure that they're actually doing what they say. Because again, it's not regulated, so makeup companies can kind of put on whatever they want. Expiration dates is another big one. Cosmetics are not required to have an expiration date. The FDA and the USDA do require drugs and food to have expiration dates on it, but cosmetics, not the same. So a product might go bad if you're storing it in the wrong way. Maybe if that place that you're storing it is too warm or too moist. There's a lot of products out there now, especially facial creams that do require to be refrigerated. I think Kendall Jenner uses one that she refrigerates. So just keep that in mind. And then lastly, look out for toxic chemicals. This is something that I'm going to go into a little bit more detail about, even though the FDA's website did not. Two reasons that I'm doing that. One, this is something that I personally am super passionate about. I found this out after taking an environmental health class in my undergrad, that there are a lot of toxic or carcinogenic chemicals in the products that we are putting directly on our eyes, mouth. Some of, things like tampons and stuff like that can have chemicals in it. And that's just crazy to me that we're doing that stuff that's not regulated. So I wanted to put that in there. And also because I think it's really interesting and it's something that not a lot of people know about. So again, we're going to go into a little bit about toxicology. So a lot of products actually contain known carcinogens. The EU regulates over 1,300 chemicals that they're just not allowed to use in their products because they're known to be hazardous or maybe not carcinogenic, but maybe are super allergenic or things like that. 1,300 chemicals. The US, 27. That's insane. That's insane that there are that many chemicals that the US just doesn't focus on. And that the EU is saying, no, you don't want any of those chemicals on your body, near your body, or anything like that. So I'll go over the big ones that you guys will look out for or should look out for. But, I don't want to scare you guys or anything like that. So there's a link between formaldehyde and cancer. A lot of chemical companies are getting smart now. And so they're not going to put the word formaldehyde on their products. They'll kind of hide it using terms like Bronopol, or, I have a list there, you guys can see it. But basically the types of products that these will be seen in would be hair straightening products, nail polish, and eyelash glue. Super scary that eyelash glue is so close to your eyes, and there's a link with cancer. Phthalates, polyethylene glycol, PFAs, PFCs, all linked to endocrine disruption, cancer, and thyroid disease. So these are going to be terms like fragrance, perfume, propylene or butylene glycol. And basically you're going to find these in anything that contains fragrances. So whether that is perfumes or even soaps, shampoos, conditioners, if you use scented tampons, eyelash glue, nail polish, a lot of cream-based products like sunscreen or hair products and shaving creams. these will have those kind of chemicals in it. Triclosan is linked to thyroid and reproductive hormone disorders. Typically, these were only found in hand sanitizers and antibacterial soap, but then people started kind of pushing against it. So it is slowly being removed from hand sanitizers and antibacterial soap. However, no one has been looking at that chemical being in deodorant, mouthwash, shaving cream, or even toothpaste, which, yeah, you're supposed to spit toothpaste out, but of course we end up swallowing a little bit of it. So same with mouthwash, something to be just aware of. Toluene, sorry, I cannot speak. I've been talking way too much. And brain toxicity, that's found in nail polish, nail treatments, and hair dye. And then parabens and hormone disruption, as well as breast cancer. So these things are found in almost anything. And they are safe in small quantities. That's why you can find them in almost anything, but it bioaccumulates, which means you might have a little bit of it in this product, a little bit of it on your car, in your mattress, and in the little doses, it's okay. But just be aware that these are going to add up and might cause issues for you, maybe not 2 years from now, but maybe 50 years from now, and that really accumulates in your body. So again, this isn't about fear. This is just about knowledge. I don't want you to go home and throw out all of your makeup products, but do be aware, kind of like I said, that this goes beyond cosmetics. So there are even chemicals found in baby toys. And that's something that's really scary to me because babies put everything in their mouths. Why are we even putting chemicals in toys that we know are going to end up in our tiny little precious babies' mouths? Crazy to me. So don't be scared. Just be aware that maybe you want to cut it out of your makeup products because you know that you have an increased risk in a different area of your life. And with that, we will move on to reproductive health. So the first thing I want to hit on is birth control, just because, you know, I'm still in school too. So we are college students. And this is something that is very common for people our age to be on. And I do want you guys to know that birth control is not just for pregnancy prevention. There are many, many, many reasons why women may take birth control, such as menstrual regulation, ovarian cysts. I actually had a friend who has been on birth control since she was 8 years old to prevent ovarian cysts from causing further issues. So really, there should be no stigma around it. I don't really think there is, but in case you feel like, you know, embarrassed to talk about it or anything, don't be, okay? But in general, when choosing birth control, think about your health, think about whether you want to have children in the future. There are permanent birth control options. Think about why you're taking it, how often you are having sex, how many sexual partners you have, if you're going to need a prescription, or if you just want to use an over-the-counter method, things like that. A lot of birth control methods, such as the birth control pill, will have a different effect if you smoke, have liver disease, blood clots, have a family history of blood clots, are taking antibiotics or other prescription medications, or even herbal products. St. John's wort is one of them that came up. If you are breastfeeding or have been pregnant recently. So make sure you're just being open and talking with your doctor when you are talking about birth control, regardless of the reason why you want to be on it. Just make sure that you are being open and honest. So no matter which method you choose, it is important to follow the directions carefully. If you don't, you can increase your risk of getting pregnant. So if your birth control pill says to take it every day at the exact same time, make sure you set that alarm. Maybe if you are getting the injections, make sure that you are setting those appointments. I think it's every 3 months. Make sure you're setting those appointments when you're supposed to. And also be very careful because certain things can actually render pills ineffective, such as antibiotics. So be very careful. You might be on antibiotics, and if you have unprotected sex at that time, you are going to have a higher risk of becoming pregnant. So another thing too that I want to add is that many of these methods can be used at the same time. So I actually highly advise you guys to use birth control and condoms, or really use condoms with any other birth control method you're using. Because, you know, the birth control method might be preventing pregnancy or might be regulating your period or whatever it is, but the condoms are going to help prevent STDs. So I really highly advise that. However, don't double up on condoms. You cannot put 2 condoms on at one time and think that, you know, you are being extra safe. It'll cause friction and can actually rip the condom. So Multiple methods can be used, but not multiple condoms. As far as STDs, HPV, and HIV go, sexually transmitted diseases are actually extremely common. 1 in 4 college students are going to get one. It shouldn't be something that we're embarrassed about anymore. I think society should be beyond that because a lot of them are treatable too. So don't be ashamed, just be responsible. Try to prevent them, use that protection, get tested after each new sexual partner. That way you're on top of it. Keep a list of sexual partners. That way, if you do get one, you can go back and warn other people, hopefully before they pass it on to anyone else. And just really be responsible with that about, being honest with your doctors. They'll probably ask, maybe even when you're getting birth control, if you've ever had one, and just, again, be open and honest. It's nothing to be embarrassed about. It is so common. But I will say too, STDs do affect women differently. So we are less likely to experience extreme symptoms. So a lot of times you'll hear, people joking around that, it'll burn when a boy pees. That's not common in women. These symptoms are not common. But we are unfortunately more likely to have long-term effects if we leave an STD untreated. So it can lead to infertility and cancer. And unfortunately, people with penises don't tend to have that long-term effect the way that women do. So it's just that much more important for us to be on top of it, to be responsible. HPV is a type of sexually transmitted disease. There are over 100 kinds, but really only 3 of the 100 cause symptoms. So it is very common not to have symptoms, but some symptoms might be genital warts, and it unfortunately can also lead to cancer of the cervix, vagina, vulva, or the anus. So treatments are available, such as treatments that'll help the genital warts go away, but there really isn't a cure. So prevention and early intervention is really the best way of doing it. I always hate to give the advice of limiting sexual partners because I don't ever want to, shame anyone, but that is one of the best ways to prevent HPV. So try it, limit the number of sexual partners, and of course, go ahead and get they're called pap smears, but here we're going to refer to them as pap tests. Go ahead and get those. You should be getting them once a year once you become sexually active or once you turn 18. What they do is those detect any early changes in cells before they start to before they mutate into cancer. HIV, similar again, it is a sexually transmitted disease. This one affects the immune system and it can turn into AIDS, which is much more severe. So again, the best thing to do is prevent it or detect it early. Most people do not show any outward signs when they first get HIV, which means that they are more likely to end up passing it on unknowingly to future partners. However, it is really easy to get tested, and there are a lot of different ways. There's blood, urine, and oral tests. Even the health center here on campus does it. And I will say too, just kind of overall with this, in the entire month of April, the health center is going to be really promoting STD tests. So something to keep in mind. There are a lot of preventative medications. There is PrEP now, and there are a lot of new treatments that make HIV actually undetectable in blood tests. So that's awesome as well. It's not really something that you should be super duper, again, ashamed of or scared if it happens. But again, be responsible and keep in mind too that as women, it can be passed to our infants through, the shared blood, as well as during labor and delivery or through our breast milk. So again, my big advice as far as this is to just always be open and honest with your partners and with your doctors. Stand up for yourself. Only you know your body and know what is normal, what is a normal period cramp versus this is crazy. Know that, this isn't my normal discharge, whatever it is, only you know your body. So if something seems off, bring it up. It is very unfortunate that women do report feeling shut down by others in all aspects of their life. And this actually extends into the medical field where women feel like they are not being listened to by their doctors. The one example that I want to bring up, because it is getting a little bit more popularity and there are quite a few celebrities now who are speaking up about it, is endometriosis. So this is a very underdiagnosed disease because it causes a lot of pain. And a lot of time women are kind of shut down by their doctors when being told this is just normal period cramps or it's all in your head, this is normal. So Unfortunately, it is one of those things that's underdiagnosed but can cause much bigger issues if it's not treated properly. So if you, again, are feeling something that seems abnormal to you, bring it up and keep fighting for it. Keep in your mind that you as a female do have a higher pain tolerance than men. That is just, we have to give birth. That is extremely painful. So it is a fact that we do have a higher pain tolerance. However, men are seen 33% faster when reporting the same kind of severe pain. The study that I saw, it was actually talking about heart attacks. So I know that we're in the reproductive health section, but really this can go for any kind of issue that you're having. But women, when they say that they're having severe pain, again, kind of end up getting shut down. And a really common term that you'll hear is gaslighting in women's health, which is, again, just the idea that you are getting told that what you're experiencing is no big deal, even though it really might be. So empower yourself. Do not ignore the problem if it is something that you seriously think is an issue. Someone down the line, there will be a doctor out there who believes you. I do have a friend who personally, she's very open about this, so she wouldn't mind me telling you about it, but she had been experiencing severe pain and had gotten shut down by doctors for months. In the middle of the night, she did wake up in a pile of blood and she ended up losing one of her ovaries because doctors just did not listen to her along the way. So this is something that I personally am really, really want to push towards you, that you guys are powerful, powerful women. So know that and go ahead and push for that appropriate test. If you feel like this is happening to you, please, please, please push back. Just some general education things for you to know. As far as sleep, again, this is something that really is applicable to anyone, but most adults do need 7 to 8 hours. So for getting better sleep, make sure that you're going to bed and getting up the exact same time, not the exact same time, but around the same time. Humans do really well with routine. Sleep in a dark, quiet room, avoid caffeine and nicotine, especially before bed. Same thing with alcohol right before bed. Give your body enough time to process and metabolize those types of things, not while you're supposed to be sleeping. Do something to help you relax before bedtime. Getting away from that blue light is a really helpful thing. Don't exercise and get your endorphins and everything going right before bed. Don't take a nap after 3. And also don't eat a large meal because, again, then your body is going to be digesting, keeping itself awake. Things that harm sleep do include stress, certain medications, long work hours or shift work, lights or noises can harm sleep, and then drinking alcohol or eating too close to bedtime all might be causing you to have not as great of a night's sleep. Taking medication to help you sleep is only safe. It is prescribed by a doctor, as they have a lot of side effects, not all of them, but they might. So even the over-the-counter meds or melatonin, things like that need to be handled properly. So don't share medications. Don't just use your friend's sleeping pill because it works great on her. It might not be at all healthy for you. So again, only take medication if your doctor is saying that you should. As far as mental health, women do have an increased risk of developing depression, anxiety, eating disorders, and body dysmorphia. What I want you to know is that you are not alone. I've had 2 friends actually this past weekend open up about one had an eating disorder and one had body dysmorphia. So it is very common. You are not alone, and there are resources available for you, either here on campus, on your phone, there's resources, or out in the community. There are a lot of things for you to do to get help if you need it. Some disorders are specific to women only, such as postpartum depression. And unfortunately, there's not that much research into those types of disorders. So again, just make sure that you are reaching out to the doctors or whoever it is when you feel that you need that help. It is unfortunate because 40% of college students do not seek the help that they need. So again, I implore you, if you need help, go get it. Make sure that you're keeping up with your treatments, whether that's counseling sessions or your medication. Just make sure you're keeping up with it. And on the, while you're also getting those correct treatments, there are things for you to do kind of by yourself as far as self-care that can either help prevent mental issues from happening or from worsening. So getting good sleep, just saying no to plans if you're not feeling it or if you have too much homework that week. Eat foods that fuel you and make you feel good. Get outside, get some vitamin D. talk to someone that you trust, set a study schedule. That way you're not overwhelmed, and limit your time on social media. This is a big one that I see out there for body dysmorphia issues, is just get off social media for a little bit and realize what normal actually is. Know the warning signs of depression, anxiety, or other mental health disorders, feeling sad, sleeping a whole lot, feeling nervous. I'm not going to read these out loud to you because I trust that you can read them yourself. But these are really important to know, that if you are, especially if you are thinking about death or trying to kill yourself, please, please, please get help, reach out. I know that this is a sensitive subject, but it is important for you to know that there are the resources out there, whether that's the counseling center, downloading the virtual care group app, or even going to places out in the community that offer the help and support you need. And then, of course, check in on your friends frequently, okay? That's a great way to prevent any of your friends from having issues or anything like that, or getting too overwhelmed, just to check in with them. It's a nice thing to do. As far as nutrition goes, most women do not actually consume enough vegetables throughout the day. I know 2.5 cups of vegetables a day seems like a lot, but that is the suggested serving size. And what I would like you to do is try to incorporate as many colors of the rainbows as you can, because that will give you a wide range of nutrients. So you can see the picture that I have down at the bottom of the screen, and it might be a little blurry for you, I can't tell, but different colors will have different kinds of vitamins and minerals in them, and will have different health benefits for you. So try to get a lot of colors. Folate or folic acid is especially important during your reproductive years, even if at this time you are not pregnant or trying to become pregnant. Starting it now early is the best way to reduce the risk of birth defects in the future. So things like oranges, leafy greens, beans, peas. Like I said, start before you plan on becoming pregnant, and then of course increase it when you are pregnant, trying to become pregnant, or breastfeeding. Being physically active is also very important, but make sure you fuel your body. Active women need more calories, and they tend to not eat as many calories throughout the day as they should. So, or healthy calories, smart calories. So make sure that if you are active, you should increase your intake of calories. Fad diets can be really tricky. I pointed out a few here: keto, paleo, and vegan. So make sure you're doing your research. Vegan is an especially tricky one, because technically you could eat French fries all day long, and that could be a vegan diet. That is plant, that is not an animal or an animal byproduct. But is eating just French fries and potato chips and soda all day good for you? No, you might be following a diet that claims that it's good for you, but if you're not doing your research behind it, you might not be doing it the right way. Other important nutrients to get in throughout the day: iron, which can be found in red meat, poultry, kale, spinach, beans, lentil. Calcium, they suggested fat-free milk, yogurt, bok choy, or other leafy greens. Healthy fats, which you can get through avocados, olive oil, salmon. Healthy fats are really important. I know that people try to avoid fat a lot, and that's not necessarily necessary, I'll say. Especially, as women, there is a chance that one day we will become pregnant, or, maybe that's something that we want, maybe it's not, totally up to you. But you'll need a little bit of cushion there to, help support a baby. So healthy fats are not necessarily something that you should avoid. In fact, you should seek healthy fats out. And then, of course, don't be afraid to treat yourself. It is all about balance. A lot of people report that when they tell themselves that they are on a diet, they end up binging. So if you just can, give yourself a little bit of what you want when you're craving it. If you're really craving a sweet at night, go for dark chocolate, frozen yogurt, fruit sorbet, things like that to, quench that sweet tooth without completely cutting it out and then ending up overindulging. Sun safety, again, something else that's really important for everyone. I will say, though, women feel a lot of pressure, maybe a little more so than men, from social media to be tan and sun-kissed and all that stuff. Trust me, I know I am so stinging pale, and I wish that I could be more sun-kissed year-round. But, well, wrinkles are still beautiful and everything like that. Skin cancer is not. So let's just try to prevent getting too much sun or unhealthy amounts of sun. That may lead to skin cancer. And in fact, any kind of tan is a sign of skin damage. Burn, definitely a sign of skin damage. So something to look out for. Use sunscreen whenever you're outside, even if it's cloudy or you're just walking from your car into the classroom. 80% of UV rays can actually get through clouds. So again, even if it's cloudy, make sure you're putting it on. Broad spectrum is something that you want to look for because that means that it is blocking both UVA and UVB rays. 15 SPF or more is recommended, and you should reapply it every 2 hours or more if you are, going swimming or things like that. Using makeup or a moisturizer with SPF in it is a great way of making sure that you're wearing it every morning, even if you are just running into the grocery store. But I will say it is not necessary to put on SPF products at night. Technically, it is a chemical. So if you want to have, your morning moisturizer that has SPF in it, but you have a different one at night that doesn't, that's great too. Even if you wear sunscreen, vitamin D will still be absorbed. Fair skin tones are more at risk, but everybody should be careful. Sun lamps and tanning beds do cause cancer. A lot of times they can lead to actually an increased cancer risk because you are using a really potent amount in a short amount of time. Personal note, there are some amazing self-tanning lotions out there. Again, like I said at the beginning of this slide, I wish I were a tanner. But the way that I do it a lot of times is self-tanning lotions. It'll give you that natural and bronze look without any risk. But I always tell myself this, and I'll tell it to you too. You are beautiful just the way you are. So don't feel like you need to be any tanner than you already are. Perfect. Medications. Use medications as prescribed or directed. Don't share prescriptions. I kind of talked about this already, but doctors base the dose that they give you on a number of things, such as your family history, your metabolism, the hormone levels that you already have. Maybe they perform blood tests before prescribing you medication, your height, weight, things like that. So the dose and usage that is safe for you might not be safe in your friend and vice versa. So just make sure that you're using your own medication, not, sharing or anything like that. Make sure that you're storing it safely. Some needs to be refrigerated. Make sure you're asking your doctors questions, especially if there are things that you want to clarify, such as the expiration date, what those active ingredients are, any side effects, what the generic name is. And then, of course, can you take it if you become pregnant or are breastfeeding? Please safely dispose of old or expired medicine. This one's kind of a personal request. Some medications are actually really bad for the environment. There is actually a lot of diabetes medication in our waterways. So make sure you're disposing of it properly. Check with your doctor on how to do so. Be careful when mixing medicines together or with alcohol and other drugs. It is very common to black out on antibiotics because they increase the effects of alcohol. So if you are on antibiotics for something, be really careful if you choose to consume alcohol at that time. And like I said before, antibiotics can actually make birth control less effective. So again, keep that in mind. Some medications can affect your driving or even your mood. So again, read those labels. And then many cough, cold, flu, fever, headache, and pain medications all contain acetaminophen. So if you have a cold and you are taking a cough medicine, a cold medicine, and a headache medicine, make sure that you are not overdoing it on acetaminophen. This is kind of, going back to what I said about be careful when mixing medications together. Just think ahead, be smart about it. All righty, and I will open up the floor to any questions that you guys might have. Thank you, I appreciate the applause. And of course, thank you guys all for listening, or if you're watching the recording of this in the future. Again, my name is Michelle Hazlitt. I am the coordinator of student wellness. And there on the screen right now, you can see my email as well as my office phone number. So if at any point you guys do have questions, please reach out. But I see right now we have none. So thank you so much. I really appreciate your time. Have a great day.